bilharzia. You would catch this from infected fresh water, and it's actually a parasitic worm that is released from snails that are in the fresh water, usually around the reeds, and you would go swimming or just have contact with the fresh water, and these tiny little parasitic worms will go through your skin. They can actually get through your skin in next to no time. Some will be through very rapidly. Others can take up to 10-15 minutes to work their way through your skin, but because they're so tiny, you can't see them, you can't feel them, you don't know you're there. They make their way to that area, they mature, produce eggs, and it's those eggs which the humans then release back into infected water, which they infect. The eggs move through, it's another part of the life cycle, they hatch, they will then infect a certain type of snail that's living in that fresh water. The infection matures, and little microscopic worms are released from the snail back into the water, where they go look for a human host. So this is a cycle which is ongoing and will continue ad infinitum, and this is how people get infected again and again and again, and how a higher worm burden causes more severe illness. Shortly after the little worm has just burrowed through your skin, you're going to have a minor allergic reaction. You're going to have an itch, a rash, a bit of redness in the area. Maybe a couple of months later, 1 to 2 months later, and this is quite indicative of the time of this, you will get a fever, chills, very often a cough, and aches and pains. Now they in themselves are very difficult to distinguish to the signs and symptoms of many other illnesses that you would have exposed to, but the 1 to 2 months after is indicative of schistosomiasis if you actually get these. And these worms will infect different parts of the human. Sometimes it will be liver, sometimes it will be intestines, sometimes bladder, and obviously that in turn will cause different signs and symptoms. And what tends to happen is not a reaction to the worms, but it's actually a reaction to the eggs that the worms are producing, and it's an allergic reaction. If you've been in an area that's been infected, you should go for a blood test after you get back, so that you can get a positive blood test. It's very easy to treat. Depending on what type of worm you've got, you'll be given a different dosage of usually the same drug, but it's generally very well tolerated, and treatment can be complete. You don't wash in contaminated water, you don't shower, and you don't swim in it. Also, limit your exposure down to a few minutes if you can, and when you come out from having your shower or your quick swim, give yourself a good rub down with a harsh towel, and what that will do is those parasites which have those little worms that have not quite made it through the skin all the way will be damaged. The tiny bit that's still sticking out from the skin will be wiped off, and the worm will die, leading to no infection. And you may still get just a slight bit of irritation at the site, because the head has penetrated the skin, but certainly you won't get a severe infection.